It's a great question. And bear in mind that all this has to do with two things. One, the bar is set very high. With monthly anti-VEGF injections, more than 90% of patients have stability or improvement of their vision. That's a really high bar. That's what we come to expect. Obviously, we want to catch patients early and diagnose them and treat them early because they tend to do better, but how do we get better outcomes? The other component is how patients are treated by their physicians. Many times we look at biomarkers such as retinal edema as seen on OCT to determine disease activity. So if we see fluid on an OCT, that equates to active disease that we oftentimes want to treat more frequently. So seeing no fluid equates, at least in my mind, to less disease and maybe we can treat less frequently. Brolucizumab had more patients, a greater percentage of patients who could be treated every 3 months with reduction in retinal edema compared to aflibercept in their phase 3 Hawk and Harrier trial data. So at least in my hands, I see about 20% of my aflibercept patients who are treated every 2 months or even monthly who still have persistent fluid. Those are the subset of patients that I'm excited to try brolucizumab in.